And welcome back. I'm Dr. Ira with my co-host Leah again, and this is Preserve Health Talks. On this episode, we're going to talk to Dr. Patty Cox from Cox Chiropractic Care. Welcome, Patty. How are you?
Thank you. Great. Thanks for having me.
Great. So, a lot of our viewers are sometimes skeptical when we refer them to chiropractors. So, in order to ease them into going to a chiropractor, we thought we'd talk to you today about what chiropractors do. And can you explain what chiropractic care is and how it differs from, say, other forms of healthcare?
Of course, of course. And yes, we do get that a lot. In fact, my own family was skeptical when I actually became a chiropractor, interestingly enough. So, with chiropractic, we're big into restoring the innate intelligence of the body. And in fact, one of my favorite quotes is from Hippocrates. He said, "Look well to the spine for the cause of disease." And we're big on restoring function through the central nervous system. So, since when you're created from a ball of cells into the spine and branches out the nervous system. So, what we do is we remove the interference that's affecting the nerves, because the nerves are affecting the organs and the function of our health, not just for pain. So, and we have many different methods for people who are scared of being manipulated, if you will. So, there's all sorts of ways to work with the spine for the best of that patient, and it's an individual basis.
What are the most common conditions that people seek chiropractic care?
Oh goodness. Well, we see a lot of crazy things sometimes, but the most common, I guess, would be headaches. There's so many people that suffer from headaches. I mean, you can think of most people, headaches, back pain, neck pain, auto accidents. But then we get some mystery cases every now and then too, where people have numbness and tingling, of course, advanced issues with their disc and all sorts of other things.
So, how does spinal alignment affect overall health beyond just back or neck pain?
Yes, okay. I love this because 10%, and I know I don't want to get too sciencey with you, but 10% of...
This is a science show.
Okay,
Get as sciencey
yay!
as you want.
Awesome, I love it. People feel pain. It's interesting. It's one of the last symptoms that they get. It's also the first to go away. And I remind people that because you could have a dysfunction in the spine for a long time before you even feel the pain, right? So that's not the only indicator to come in, right? So let's think about the nerves that exit the spinal cord, right? We have 31 pairs from the base of the skull all the way down, and they each go to a specific part of the body. So your original question was, what else does it affect, right? So, okay, I want the neck pain to go away. Okay, 10% of those fibers are saying pain signals. But what about the innervation to your diaphragm, your thyroid, your sinuses? There's so much more to it than simply pain. An example I do like to give people is when you observe somebody that's been paralyzed and you look at them, the instant thing that you think is, oh, that's so sad. They can't move their legs. They can't feel anything. And that's where our mind simply focuses a lot. But really, they've lost their bowel, bladder functions, their organs that are going from those specific nerves. So when we address all of that, we can give the best function and flow to the nerves. Then the organs are going to function better. So...
That's amazing. There's a lot of skepticism around chiropractic care. So how do you address these concerns about safety?
Okay, yes, you're right about getting your neck adjusted, especially. Yeah. I remember that because when I was learning to adjust in school and my brother and sister wouldn't let me practice on them. They were like, no. So that was quite funny. But yes, so like I said before, there's so many different ways to adjust the spine. You don't have to crack, right? But we like to remind people, as far as dollars go, you can look at malpractice insurance and say, a chiropractor's malpractice insurance is not very high. So if it was really risky, you better believe they'd be happy to collect more from us on a yearly basis as far as that goes. So it's very, very low, actually, surprisingly low. So we assure them with that. And of course, give them the options. Like, we never want somebody to be scared. Otherwise, that's not worth it. You know what I mean? I want them to have a positive experience, and then we'll find a way to move the bones without manipulation.
Are there certain people that you would say, no, I'm not going to manipulate you. I think that would do more harm than good.
Definitely.
And give us some examples of that.
Okay, well, first and foremost, I can say my daughter has rheumatoid arthritis, and people with ligamentous instability, we would not want to adjust their neck manually. And there's a lot of autoimmune conditions in addition to RA that will give that ligamentous laxity. But also, like, that's why your intake and your rapport building with your patient, like you guys were just saying, how much time and care they spend with their patients is so important, because you might miss things. They don't have to have an autoimmune disease for you to be concerned that they have laxity, because a lot of people that crack their own neck, it might be you. Don't do it. Hire a professional. But people who crack their own neck are doing a lot of damage to the ligaments. So that is a big no. If they're fused, you actually can get adjusted. So there's probably a lot more to it than that to answer your question. But those are some of the main ones that we would say no.
Okay.
Can you walk us through like what a first time visit would be like and what patients can expect?
Yes, of course. Well, you know, I love our office because this is, you know, a family thing, just like with you guys. So when people come into our office, I hope they feel very welcome. And so we'll always take x-rays. We have a digital x-ray machine, and we always remind people, listen, you need these x-rays. We're not going to guess on your health. We need to see where you're at. So they're going to get x-rays. They're going to get an exam. We're going to talk about their history for a long time. And then we'll adjust and observe and come up with a plan and discuss that at the next visit. And then we'll go from there.
And how do you determine how many sessions a patient would typically need?
That's why we need that x-ray. So it depends on the level of degeneration of their spine. Simply, if it's just, let's say, arthritis, we're going to look at all of those things and come up with a plan, but it's not a cookie cutter thing, so I can't say 12 or 16.
Right.
And I also remind them, hey, look, it took your body all this time to get this way. Let's see how your body responds, and then re-exam, reevaluate, retest things. We're always talking to our people and making sure we're on the right path.
So let's say I have a patient that comes in to see me, and they're skeptical. And they say, well, you know, I've had this pain for a long time. It's in my neck. I've had some epidural injections. They haven't really worked. I'm seeing pain management. You're telling me maybe I should see a chiropractor. How do you address that skepticism?
Oh, goodness. Well,
That's a tough question.
yeah, it really is. I like to remind people to listen, hey, if you haven't tried everything yet, chiropractic is a conservative care. I remind them this too. There are no erasers on scalpels, okay? Modern medicine and neurosurgery has its place in this world, and it is important, and it can be life-saving at times, but it's scary. So is it really that bad? If you want to try chiropractic, remind them all the gentle things we do. Show them, you know, a little anatomy lesson of the spine. Like, hey, look, just a simple adjustment can even take pressure off the nerves, you know, so why not give that a go and have that as your preventative, you know, quality of life. I mean, come on, surgery there's a lot of nuances to surgery, you know, and not everybody comes out the other side like they want to either. So.
Got it.
Yeah.
So things are constantly evolving in healthcare. So how do you stay current and up to date on research in the chiropractic field?
Well, we have to do lots of continuing education, so I think that definitely helps. I mean, I think of us as lifelong learners, and we're really passionate about our people, so it just comes natural to, you know, in our free time. I'm reading a magazine, or he was just asking me about my free time, but really, if you're a person that God put a passion in you to help people, it just comes natural that we're always wanting to learn and, you know, talk like I'm talking to him today, learning more about how we can help our people. So I just keep trying to do the best for them that I can.
So here's a good question for you. So you've adjusted someone. Is there a take-home version of the game? For instance, if I were a game show host and you're a chiropractor, and I said, you know, I've been adjusted, I've been on your show, so to speak. What can I do at home to maintain my spinal health?
Oh, okay.
That's where I'm going with that.
Okay. But I'm not coming up with a game, right?
Right.
Okay, because that was almost a trick question. Well, we do teach our people a lot about that, and that is super important because if you're moving the bones and you're not addressing the soft tissue as well that's attached to the bone, which is why you can move, right? Look at this. This is a pulley system, and that's an easy one to see. But if you're not addressing the alignment and the soft tissue structure, it's going to keep going back. It's going to have a propensity to go back to where it's comfortable. So, oh my goodness, we are all about home care. We teach our people what they need to be doing, certain stretches, certain exercises. Because there's a certain group of muscles that are overly tight, and there's a certain group of muscles that need to be stretched. I could go into a long thing about that.
And that's why we're going to have you
Yeah.
back on the show
Yeah.
again in a few weeks.
Okay.
So this is going to be a multi-session show, sort of like, going to see a chiropractor.
Yeah.
So we're going to bring you back. We're out of time.
Okay.
But it's been a pleasure having you on here this morning. It's been so much fun.
Oh, you're awesome. High five.
Yeah,
Look
this
at
is going to be
that.
great.
See?
So Preserve Health Talks.
Mm-hmm.
This is Dr. Patty Cox. She seems really good. I'd recommend you.
Thank you.
Okay.
I'd recommend you too.
Thanks for watching this episode.
Thank you. Bye.